Good morning.
Hi,
How are you?
doing well. How are you?
Good. It's been a while.
It has been a little bit, yeah.
Yeah. Thanks for joining me, Dr. Detterline.
Sure.
Yeah. You've been doing with everything that's going on.
Well, we're adjusting, I guess, is the proper terminology for it. It's definitely something that is not what it traditionally has been for a really long time. So you have to adapt to the circumstances, and we're going to kind of be in this for a while now. So it's not
Yeah.
one of these things that you can just kind of wish would go away. And um, you know, you'll wake up one day and everything will be back to normal. That's just not going to happen. So,
Yeah. I know. I think we all feel that way. It's a lot of acceptance on, just where we are and yeah, it's definitely different for sure. So, why don't we start, Dr. Detterline, just by maybe you giving a little introduction to the type of surgeon you are and what your background is, and maybe some of the things that you specialize in, just so our audience can have an idea on that.
sure. So, my name is Alvin Detterline. I am an orthopedic surgeon who is fellowship trained in sports medicine. I am a member of Towson Orthopaedic Associates in Towson, Maryland. And I have been with Towson Orthopedics for almost 12 years now. Uh, Being a sports medicine specialist, my area of concentration is in arthroscopic surgery. So that involves, sticking a camera inside of a joint through small little incisions in that rather than cutting the joint wide open. So arthroscopic surgery is minimally invasive surgery, and the joints that we do that most frequently with are the knee, the shoulder, and the hip. So those are kind of my areas of focus is arthroscopic surgery of the knee, shoulder, and hip. And that varies anything from you know uh, major ligament reconstructions in the knee to arthroscopic surgery to fix labral tears in the hip to fixing rotator cuff tears arthroscopically in the shoulder. So there's a wide gamut of things. I did my orthopedic residency at Rush University in Chicago, which is one of the largest orthopedic groups in the country. And then I did my sports medicine fellowship in Cincinnati, Ohio, with
Mhm.
Dr. Frank Noyes, who is one of the founding fathers of arthroscopic surgery and reconstructive surgery of the knee, shoulder, and hip. So
Mhm.
it's something that I really have a great interest in. It's a passion of mine, and it's something I really enjoy.
Yeah. Yes, I think at this point, it's so funny. I guess I met you very early in my PT career. And thanks to my patient was a Calvert Hall football player. And he said, you got to come down and meet my doc. And so, like, that's how I got to meet you, which is such an awesome opportunity to be able to have patients that feel so passionate about what you do, what I do, want to bring us together. I think that's really what it's all about. And then from there, I got to come in and observe with you. And I think even in just the few hours that we were together, I think we saw an arthroscopic shoulder procedure you were doing. I think we saw two like arthroscopic knee procedures. I know I've treated some of the labral repair, hip repairs that you've done. So obviously some great work, and it's always been an awesome experience learning from you. And I definitely appreciate that. It certainly helps us in our field to be able to have those times where we can sort of put all of the pieces together because, we obviously learn the anatomy and, we're learning all the exercises and really all the details about how the body works. But once you can actually see those repairs and replacements and sort of get more of an idea of what's going on there, it really just brings it all together. So definitely an awesome opportunity. So I always thank you for that. So I was curious, what do you feel your challenges have been during this pandemic, being in your field, specifically orthopedic surgery?
Well, I mean, it's kind of changed as we have gone through the pandemic. I mean, in the beginning stages, when everything got shut down rather abruptly, it was, trying to make sure that the patients that just recently had surgery were still able to be in contact with them and check in on them and make sure they were doing okay, and that, if there were disruptions to their physical therapy regimen, what things they should be doing at home to kind of bridge the gap and things like that. So in the very beginning stages, it was very much making sure that the patients that had surgery in February and the first part of March were not adversely affected, because they were unable to go through the traditional recovery and rehab process that most patients are afforded. And so that was the initial challenge. And then as we got farther along with that, it was, how to get patients into that kind of next phase of recovery, while at the same time dealing with, the accidents that happened at home and things like that of patients, trying to, you know, paint their ceiling by, climbing on their furniture and then falling off and things like that. So we had some of those episodes that occurred. So dealing with those acute injuries, and then, lastly is now trying to kind of open back up, and the patients that had intended to have surgery during the pandemic, but had to have their surgery put on hold because we weren't allowed to do any elective procedures for a couple of months, how to, get those patients the care that they need. So, that's the phase that we're kind of working through now. I anticipate the next phase will be based upon how we kind of reintroduce, return to, organized and recreational sports for so many people, because, so many people have been trying to, do stuff in their backyards and things of that nature. Well, that's a limited ability to be able to do certain things. And when we try to get people back out on the soccer field and lacrosse field safely, we got to make sure that we're doing it in a measured fashion, because it's not common for a lot of these individuals to have gone so many months without playing those sports. And so you can't just pick up where you left off. And a lot of younger people are kind of used to that. They just transition from one sport to the other, and it just feels like it's just a continuous cycle. But there's been a major disruption in that cycle right now. And, with how long that has gone on, it's not going to be just, all right, let's start practicing lacrosse again, or let's just start practicing soccer again. Because if we do that, I think we're going to see a much higher incidence of injury happen, because those individuals are not conditioned to be able to do those sports in the same capacity that they're used to. So, we hope that the next phase of this is a safe reintroduction into returning to sport, and people go about it smartly, so that we don't see that rise in preventable injuries that are tragic when they occur.
Yeah. And I think too, obviously that's been an importance for a long time, right? Just like trying to find a way to bridge that gap between, getting through your rehab and returning to play. There's always been a concern about how can we make that better. But I think this time period has really definitely, it's going to be challenging to slow those patients down and really make them understand the importance of it. But I think one way is, I know like for us here, we have kind of developed their own lower extremity functional assessment where we pretty much just take them through all of the different tests that, are out there in research, the single, the single leg hop, triple hop, crossover hops, the 1RMs and the quads and the hamstrings, and just showing them the deficits. And I feel like sometimes once they see like, holy crap, yeah, I'm not ready to do this, that's almost kind of like the validation that they need to practice more and do a little bit more before they're ready for returning to the field. So that's something we here feel very strongly about. And we're not doing it just with like post-op patients, like even patients that come in with, a minor knee strain or a meniscus injury that's non-repairable, or they're not going to get surgery or something like that. Or just any kind of, injury where it's not necessarily at that point that it needs the surgical intervention. We still try to show them that, like, hey, look, this is what your body is doing now. And if you don't, if we don't address those and you go return to play before meeting this guideline, there's an increased risk for injury, right? So I don't know. We try very hard to make sure that patients can see the deficit themselves, because I think that's really when they're more accepting of what you're telling them about returning to play. Because it's really hard to just tell them, hey, look, research says it's been 6 months, so you shouldn't do it. Like, it's sometimes just not enough. They can't like wrap their head around it, So that's something too that, if, I feel like too, having like open communication with you and the surgeons and being able to talk back and forth about where the patient's at really is helpful, and making sure that these patients are getting the best outcomes. And we did some telehealth too, which was really interesting. It's like the creativity is flowing for sure, because next thing you know, you're like loading up backpacks and you're, grabbing tools and all kinds of crazy stuff just to really make sure these patients are getting 360 degrees of loading, right? We're trying to make sure that we're capturing every possible area of weakness or dysfunction via a video. So it's been interesting. I think we've done the best we could with what we have right now. And I think that's just what's most important, and making sure our patients stay accountable. But yeah, so right now, are you still, I know you were team doc for Calvert Hall. What other schools are you potentially covering, and how is that being affected right now?
Well, yes, I am still the team physician for Calvert Hall.
Okay.
I also cover their sister school, Mercy High School,
Okay.
and Friends School in Baltimore, as well as Parkville High School.
Mm-hmm.
Our group of Towson Orthopaedics covers several other schools in the area as well. And, there's been a lot of disruption with all facets of that. We had athletes that got injured just as, spring sports was kicking off in March, and needed to have surgery to fix their injury, and they had to be put on hold while elective surgery was postponed. And that, had a significant impact on their timeline for recovery, in terms of, okay, well, they needed enough time to get through the recovery process for them to be able to play, sports in the future, whether it be, fall sports, winter sports, or spring sports the following year, in hopes that we were going to have those types of activities for them. So, we really had to try to prioritize those athletes to make sure that we tried to get them taken care of, and try to provide a least disruptive timeline to their recovery process as possible. Because, it's bad enough that they all had to miss one season of participation. We don't want them to have to miss two. That's really a difficult pill to swallow for a high school athlete, when you only have an opportunity to play four. right? So, these aren't redshirt years that they can make up in that. So, this is some kids, only time that they're going to be able to play competitively. And, you want kids to be able to enjoy that experience because there's a lot of valuable life lessons that can be learned from sports participation.
Yeah, absolutely. So do you feel like with you know, the position that these kids are in now, that referring to physical therapy or getting them in with someone to just try to keep building up that strength and keeping up that endurance and the stamina and finding things that they can do to still continue to challenge them and prep them for sports is going to be more helpful?
Yeah, I think it depends on each individual and what structure they have in place. I mean,
Mm-hmm.
I know that, there have been attempts to try to do some, individualized training and stuff like that at this point.
Mm-hmm.
And some kids have access to that and
Mm-hmm.
others don't. And
Mm-hmm.
so, it's individualized based upon, what each kid has the ability to have access to. And, their sport is also very critical in that too, because
Yeah.
you there you can't mimic those types of sports, such as soccer or football, and that you can train and you can improve your fitness and your cardio capacity and your baseline level of strength in that.
Mm-hmm.
But it's the old adage that football coaches say, right? You're not in football shape unless you play football.
Football. Mm-hmm.
And
Yeah.
that's true in soccer,
Mm-hmm.
that's true in lacrosse, that you really need to be playing those sports to be in shape to play those sports. And
Mm-hmm.
that's why, depending on what activity you're involved in, there should be some runway to
Mm-hmm.
allow kids to get up to speed.
Yeah.
I mean, and physical therapy can be one of those tools that
Mm-hmm.
can show kids what level that they're at now, and use, like you mentioned before, some objective data to say, look, this is where you're at right now,
Mm-hmm.
and this is where we think you need to be in order to be able to play at the level that you want to play at.
Mm-hmm.
And this is what we think is going to take for you to get from where you're at now to where you need to be.
Mm-hmm.
And I think that can be very helpful. I mean, physical therapists can play that role. Athletic trainers can play that role.
Mm-hmm.
Personal trainers can play that role now that gyms are starting to open back up
Yeah,
again and things like that. So, there's a lot of different avenues that
absolutely.
the athletes will have access to. But
Mm-hmm.
we want them to take advantage of something of that capacity. So again, they're doing their return to sports and activities safely.
Mm-hmm. Yeah, and maybe after this, I can take you on a quick virtual tour so you can see our turf, because that is something we try to do, is really just get like that soccer ball on their feet or get that stick in their hand, or, even if it's not at a level where they're back to like playing, but just being able to utilize the space that we have in this facility to really get them to dribble and do drills and try to mimic some of those like game time cutting and pivoting and all of those things. And so I agree. I totally think that, you can't dance if you don't dance. You can't play football if you're not, you know what I mean? It really is so specific, and your body has to remember those movement patterns. So the sooner that you
Yeah.
can be involved with it. And I think too, it's motivating, right? So that's what they like to do. That's where, you want to get the ball in their hands or whatever it may be. For sure. Um, yeah. And what do you feel like? Do you feel like there's anything lacking? Or what would you like to see more in post rehab? Like, what kind of things do you feel like we maybe are still dropping the ball on, or we could all be better at?
Well, I mean, I think that the beginning stages of recovery and that is done by and large very well. To get patients their range of motion back and start on their resistance exercises, things like that. And then it's the stuff that comes after that that I think we still don't necessarily have a great grasp on. And that comes from a variety of challenges. I mean, some of it is that, okay, by the time that they reach that level, they've kind of gotten tired of the routine. So that's part of it. The second part of it is an anxiety or desire to want to skip ahead and just be done with it. The third is the curtailing of access to physical therapy prematurely because of insurance benefits and other things like that. And so it's one thing to get individuals back to being able to carry out normal daily activities and even do a reasonable level of fitness exercise and stuff like that. It's another thing to get patients back to competitive sports. And too often I think there's not a very good bridge from the conclusion of physical therapy to return to sport. And as you kind of hinted about it earlier, we tend to try to get caught up too much in time as the factor of that. Oh, it's been 4 months, I should be able to do this. Oh, it's been 6 months, I should be able to do this, et cetera. Well, that time plays a role in terms of the biologic healing that we need to occur, but it's also very dependent on muscle strength recovery and stamina recovery and flexibility recovery and all of that is very individualized. And so all of that needs to be taken into account when we're trying to return athletes to sports. And unfortunately, I think we end up having athletes doing a little bit more kind of freelancing and independent work than would be ideal, because I think it would be better if they had more supervision as they worked through the soccer specific drills or the other sports specific activity. And then I think it's important that we test objectively with athletes before letting them go back to play, because we know that reduced strength or neuromuscular control puts them at higher risk of re-injury. And that's a devastating thing for an athlete or anyone to go through a extended recovery period and finally feel like they're back out there and then re-injure themselves because they weren't quite ready to get back to what they thought they were capable of doing. So I think we do a good job in the initial stage, but it's the secondary training that I wish that we had more uniform supervision of individuals, and as they go through the recovery process to coach them exactly how that progression works in a safe manner.
Yeah, we actually started doing, so obviously we're doing like around 16 weeks. We definitely do testing. This is really more specific for like an ACL repair, but we start to sort of initiate some of the exercises that we're going to be doing beforehand, so they kind of have an idea of what they can expect when we get to testing, and we talk about it and sort of prep them for it. And then at 16 weeks we do a test, and then at 24 weeks we retest again. And then we actually tried to include them in like a post-rehab group where they can, financially, it just depends on where everybody is at, right? But at least if they have an opportunity to continue for maybe, a different price point or something where they're in a group setting and they're all recovering from these, procedures. And now they have someone else to train with, a little bit of competitiveness. They're guided and they're really loading up and kind of getting that sport specific training. And it really has been helpful. I mean, it's really amazing to watch too. I mean, like you said, the monotony of going to PT and going through all this stuff, like it really sometimes makes it challenging for people to want to get to that last bit because they sort of are just so sick of it. They just want to jump to it. But I think we found too, just by having some of these smaller groups in our post rehab group, they feed off of one another. And it's just that little bit of extra sort of gets them through the rest of those weeks of waiting to sort of get back to the field. And so I don't know how, what is your kind of, I guess it's probably hard to say, but do you have like a specific return to play sort of protocol or thought process, or what are you looking at when you're really deciding whether or not they're ready?
Well, I mean, so there's different layers to that. So, the first is they have to have the basic, physical exam, characteristics. They got to have, the full motion to the joint. They have to have, normal stability. They have to have, appropriate muscle girth and no swelling on the joint or anything like that. I mean, those are the baseline requirements. But again, it's once you have those, it's what your functional strength is. And that's really the most critical thing. And I tell patients all the time, I can't measure that very well in a doctor's office. I can't tell how well you run. I can't tell how, how well controlled you are in your landings from jump or things like that. Like that's where therapists become very critical in terms of, correcting, form and technique and things like that. I mean, the landing characteristics from jump are so important, and the core strength that is necessary for proper balance and coordination and all that. So to me, I look for all of the functional measurements that the therapists are measuring and that, but I also like to read their subjective comments too of, if they're doing a single leg crossover hop and stuff like that, how did the therapist perceive how they looked in doing that? Did they look like they were hesitant or reluctant, or did they look confident? How was their, I mean, it's not just a matter of, what's your, triple hop time or distance or things like that. How did you look in doing that activity in terms of, like I said, proprioception, neuromuscular control, balance, confidence, those types of things, because that is very important to have all of those things before you return to the field.
Yeah, and I think it's awesome, just this day and age, we can video that stuff. And, I think too, that's something if you ever want to see it or like have requests, I mean, we use all different kinds of apps now. So that's always available to you if you ever want it. I think obviously subjectively we can write it out for you, but if you're a visual person, you might just want to see it yourself too. So don't ever be afraid to just say, hey, look, I'm sending someone down. I want some visual, and we can obviously record some of that stuff for you too.
Sure. No, I mean, the technology things that we've improved upon during this pandemic really, I think, are going to change the way, we practice medicine and sports medicine, particularly moving forward. I mean, the change is probably long overdue, but sometimes it takes a very unusual situation like we've been exposed to force the change to happen quicker than it would naturally occur. So.
Yeah, absolutely. Trying to think if there is anything else specifically. I know. Are you doing any research right now? Do you have any things you're working on?
I don't have a research staff that works with me, so it's kind of hard for me to compile and do all the data analysis and stuff like that, and still, see and take care of patients and things like that. So, we've talked about trying to do some collaborative work with some of the other doctors that are part of the University of Maryland system and that. But our virus pandemic has kind of thrown a bit of a monkey wrench into some of those currently. So,
Yeah.
and the residents that work through the University of Maryland and stuff like that, had to go through quite a bit of changes to what their normal workflow would be and stuff. So,
Yeah.
hopefully, when things get back closer to normal, that stuff can resume more.
Yeah, absolutely. I know I did hear that from one of the residents I was treating. He said it's been quite an experience for them too. So it's definitely, everyone's being affected all the way around. Yeah.
Agreed.
So, do you have any like special things that you want to say, or anything you want to speak to physical therapy specifically, or just anything else that you would want to share with the community?
Yeah, so I mean, a couple things. Whenever you're recovering from a significant injury or surgery or something like that, I always tell patients that the recovery process is a three-legged stool. And you need to have the right treatment prescribed or performed by your doctor. You have to have a patient who is committed to playing by the rules and committed to going through the recovery process. And thirdly, you need a physical therapist that is capable of tailoring the rehab to the individual that they're working with. That is so critically important. And we can't treat every patient or athlete the same. Everybody's different. Everyone is going to progress through a rehab process a little bit differently than the next person. And when we tell patients what the recovery timeline is going to be for a certain injury or procedure or something like that, we're giving them averages. And by definition, there's going to be people that are going to be on the shorter side of average and the longer side of average. Well, guess what every patient thinks? They're going to be on the shorter side of average, right? And so, and I tell patients, well, if that were really true, the average would be different. So, I mean, everybody thinks they're better than that, and that's natural human tendency in that. But it's so important to have therapists that have taken patients through these recovery processes multiple times. They know the pitfalls, they know the bumps in the road that are expected to occur. And that's really, really helpful for patients because most of the time they've never been through anything like this before. And so, it's having that person that says, look, I know this isn't unexpected, or, you're placing unrealistic expectations on yourself, or you are, you are doing fine, everything is going well, don't be discouraged, and those types of things. That is really, really important. The patients continuing to be committed to the recovery process, maintaining the positive attitude that is really important in the recovery process, and ultimately having that person achieve the goal that they want, whether that's just being able to, play in the backyard with their grandkids, or if that means, playing Division I lacrosse or soccer or something like that. So, it's so important that all of those components are in place for you to expect the desired outcome to happen. And when one of those components is missing, it just doesn't go as smoothly. And so it's really important. And the other thing that I would mention is, again, it's so important to individualize the recovery process for each person, because ultimately it's what the patient's goals are that are most important in terms of what they want to get back to doing. And we don't treat the person that wants to get back to just playing with their kids in the backyard the same way as we treat somebody that's trying to be a highly competitive athlete. And we have to be able to make adjustments to the recovery process to allow patients to achieve their goals.
Yeah.
And that's really, really important. And patients, we should always ask patients, so
Mm-hmm.
what are your goals? What do you want to get back to doing? And
Yeah.
that so that we
Took the
can
words
make
right
those
out of my
adjustments.
mouth.
Yeah, because if you don't ask the question, you don't know what the answer is.
Yeah.
And so I think that that's really critically important. And I make sure that I ask that question specifically to
Mm-hmm.
patients of
Mm-hmm.
what are your goals are, what do you want to get back to doing?
Yep.
And I think that it's very important for physical therapists to ask that same question so
Yes.
that that recovery can be tailored to the individual.
Mm-hmm.
I think that that's so critically
Yeah.
important.
Yeah, that's literally what I was just sitting here thinking about as you were talking. And then you said, I always ask what their goals are because I think like so often it's so simple, but it really paints the picture for them because once you ask them that, then everything you do, you can relate it back to the goal. It makes them feel like they have a purpose for what they're doing. And once they, everybody needs a purpose, right? Everyone needs to know why they're doing what they're doing. Otherwise, I mean, what's the point of doing it? So I think absolutely that is totally essential. I think too, and just having communication, like I always find when I can say, if a patient's not maybe doing what they're supposed to, or they're, starting to slide off and they're showing up for 2 appointments a week, not 3 appointments a week, I can say, okay, I'm just going to check in with your doctor and make sure he's okay with that. And as soon as you say that, they just somehow manage to find time in their schedule to get that session in. So I think too, there's just something so powerful about having the ability to communicate with you guys and keeping the lines of communication open for everyone. So it's kind of like you said, that triangle is closed and everyone knows their part, but we all know that, we can't do it without one another. So I totally agree on that. I think it's essential. So I know we're always grateful for, everyone there, the communication is great and we really appreciate that.
No, that's it. That's really important. You are 100% accurate in that. We definitely need to keep the lines of communication open all the time because that's what's going to get the best outcomes. I mean,
I think I remember too, I don't know why I was just thinking about to like being a new PT and how, you feel so nervous about asking about something that's going on, right? Because nobody wants to feel like they don't know what they're doing. But, you just kind of said it too, like every patient is different and there are going to be so many different situations and, there are going to be different living environments, different nutrition styles. There's going to be a lot of things that can affect the way that a patient presents and they have going on. And it might just be something you haven't seen before. It might be something you haven't seen before. Like, I feel like we're always learning every single day. There's just, everybody is so different. So I think, again, too, like you said, it's so encouraging just to be able to have, feel comfortable being able to communicate back and forth without that, feeling of, oh no, I'm going to like do something wrong or whatever. So
yeah, no, I mean, yeah, you have to be able to make adjustments in that because sometimes,
yeah.
Maybe, a patient isn't responding to, one, method of the rehab process. And if you adjust and, focus on a different, modification of the exercise or something like that, and all of a sudden you're able to
Yeah.
see results and stuff like that. So, it takes that back and forth for us to be able to say, well, if this isn't working, let's try this, and we would much rather know how patients are doing rather than just expect everything to be
Yeah.
going fine. And I mean, it's great when they do, and oftentimes they do, but that open dialogue really just makes everybody more comfortable with how everything is going.
Yeah.
So
So what sports do you like to spend the most time around, would you say? Do you have a sport that you love or that you play yourself?
yeah, I'm a pretty avid tennis player myself. So
Okay. I
that's
thought I
that's
remember you saying that. Yeah.
yeah. So I like that sport
And you
the
can
most.
practice social distancing with that one.
I can, yeah. So,
That's awesome.
yeah, it's nice to be able to do that again. You know, the spectator sports and that I'm looking forward to hopefully being able to be back on the sidelines
Yeah.
covering football again and all that. So I just I hope we can formulate a process that does it safely and you know allows kids to be able to have that experience.
Yeah.
So
Yeah, it is a wonderful experience. Sports really are a special part of, I feel like, growing up, and for some it's everything, right? So it is important to try to keep them playing despite everything, you know.
absolutely. Well, I mean, just fitness and exercise is important for so many people, even if you're not an athlete per se or anything like that. I mean, we all know that exercise has so many health benefits, and that so we want to allow patients to be active, and you know the best way to be active is to find things that you enjoy. Right? I always tell patients, they're always asking, like, so what's the best exercise for me to do and all that? I'm like, well,
Yeah.
what do you actually like doing?
Yeah.
So because I can tell you this, if it's an activity that you actually like to do, you're going to find time to do it because you're going to look forward to it, right? If you view exercise as a chore or something that you have to do because it's another box that you have to check, you're going to come up with excuses as to why it doesn't fit in today's schedule or tomorrow's schedule or whatever. And so, it's really it's about patients finding the activities that they enjoy doing, whether it be swimming and kayaking or
Yep.
jogging or weightlifting or whatever. I mean, there's obviously a huge range of activities that people can enjoy, and everybody's different, and we should all treat people as individuals and allow them to do the things that they're passionate about.
Absolutely. Well, I think we could definitely agree on that.
Good.
So it was so awesome. I don't want to take up too much of your time. I know you're probably busy on a Monday morning, but very grateful for you to be able to chat with me and catch up and talk about all the fun stuff that we get to do every day. And
Yeah, it's great.
if you want to, I'm going to stop the recording, but if you want a quick virtual tour, just stay on and I can show you our facility.
Sure.
All right. All right. So I'm going to stop recording now. Thanks so much, Dr. Detterline.
Sure.